Okay, good afternoon. I want to talk to you all in more detail about the behavior intervention plan and the conversation around whether or not certain professions, specifically speech and language pathology, can write behavior intervention plans and or behavior intervention goals. So the first thing that I am realizing is that a lot of the conversation and the confusion is around the different terminologies and products that are being discussed. So first and foremost, it is important to note that there is a difference between a behavior intervention plan and conducting a functional behavior assessment. The second thing that is important to note is that there is a difference between writing a behavior goal and writing a goal for a behavior intervention plan. They are not the same thing. So just to clarify and to make it clear, yes, you should not be writing a behavior goal if you don't have training in the area of behavior assessments. And so that's what is functional to your scope of practice. It doesn't mean that a speech and language pathologist can't write a behavior goal. What it means is that a speech and language pathologist should not be writing a behavior goal if they do not have training or skill in behavior assessments. In that same vessel, that is the same expectation and requirement for a functional behavior assessment. A functional behavior assessment, also known as an FBA, should only be conducted by an individual that has training in the area of identifying, recognizing, and manipulating behaviors. So that could be any clinician or special educator as long as they have training in that area, therefore making it within their scope of practice. In a general sense, a general speech and language pathologist generally does not have training in the area of functional behavior assessments, manipulating behaviors, and functionally identifying behaviors. However, if that individual does have training, then they can be expected to conduct and administer a FBA. Now, on the other side, talking about the BIP, Behavior Intervention Plan. A behavior intervention plan is a plan that is put in place to address the maladaptive or adverse behaviors that a child may present that impacts their ability to functionally learn and be successful in the academic space. The behavior intervention plan is a product of the functional behavior assessment. And so primarily an individual with an IEP in special education should not have a behavior intervention plan if a functional behavior assessment has not been conducted first. Now, a behavior intervention plan or a BIP can have both behavioral goals and goals that support the reduction or intervention towards behaviors that impact the child in the academic space. In that conversation, it is important to note that a speech and language pathologist or any clinician who is involved with the child's IEP, individualized education plan, or with the child's academic success can contribute to and or write a behavior intervention plan related goal. In my opinion, it is very important that speech and language pathologists are a part of writing and producing the behavior intervention plan goals, because most of the child's adverse behaviors in the academic space has some component of language that is impacted or that has created the behavior that we're seeing in the child. So, for example, if the goal is, or if the behavior, for instance, is that the child does not follow directions and just does whatever they want, then there is a possibility that the child may have a language-based difficulty with following written and or verbal directions, or they may have a receptive impairment that is impacting or exacerbating the behavior of difficulties with following directions. In that case, the speech and language pathologist should have a goal and or make sure the goals on that child's behavior intervention plan does not create an additional burden to the language skills that they are working on. If the child is working on recalling information and following written directions because of the impact of recalling information, then likely utilizing the steps to recalling how to calm down is not a beneficial goal to the child at this point, because it is something that they are working on in a language space. In addition, the speech and language pathologist can possibly write the goal differently so that it doesn't impact the child in the behavioral and or academic space, because the speech and language pathologist is aware of how the child's language impairment contributes to the adverse behavior that the setting is seeing. So again, the SLP may not be writing a behavior goal, but the SLP is writing a goal from the purview of their scope of practice, i.e., writing a goal that supports the language needs and language difficulties that the child has presented. That is the same for all professions that are involved in the process. For every behavior intervention goal on the behavior intervention plan, there should be some contribution from everybody on the team. Again, keeping in mind that the key word is behavior intervention goal. It is not necessarily a behavior goal. It is a goal that assists with reducing and or redirecting the adverse behavior that the child may be experiencing or producing. And so again, you can write a behavior intervention goal. The speech and language pathologist can also be a part of developing the behavior intervention plan. You should only conduct a functional behavior assessment if you have training and skill in that area. But everyone should be a part of the behavior intervention plan development and the goals on that behavior intervention plan. So now that we've clarified that, let's talk about the benefits of a behavior intervention plan. A behavior intervention plan is a safeguard sometimes to what can happen to a youth on a special education caseload when a manifestation meeting is necessary. Specifically, a lot of times, especially with our Black youth, the behaviors are criminalized and penalized. And so when a manifestation meeting happens, one of the requirements of the manifestation meeting is that the child's IEP and behavior intervention plan is re-reviewed to make sure that the goals on the behavior intervention plan supports the needs of the child effectively and was not in place, but was part of the manifestation of the behavior that the child presented with. This is where the speech and language pathologist inclusion is very important, primarily because if you did not know, which everybody should know, behavior is a form of communication. It may not be functional communication to you, but the child is communicating something. And when the child is communicating something, either we are going to step in to restructure and make that communication functional, or we're going to allow them to continue to have adverse behaviors and impacts because they have no other functional outlet for their communication. So the behavior intervention plan should be supported and included with speech and language goals, because a lot of times what happens on a BIP is that the goals are very subjective, the goals are very problematic, and the goals are also not recognizable or supportive of the child's language needs. For instance, I've seen behavior intervention plans where the goal is the child will make good choices. First of all, the statement "make good choices" is subjective. What you may consider a good choice may not be what the child considers a good choice. To expect the child to already have a baseline in understanding what you consider a good choice is a problematic process that happens a lot on BIPs, where there is not any inclusion of what functional communication and supportive language is. In addition, a child making good choices requires that the child has functional executive functioning and problem-solving skills, both within the scope of practice of the speech and language pathologist. Another one, the child will recall the rules too. Again, can be very problematic if, for instance, the child has processing difficulties or memory deficits and or literacy impairments secondary to a unstable or non-existent language baseline. And so at all times, the speech and language is necessary to support the behavior intervention plan to help reduce the likelihood that during a manifestation meeting, the child is being punished or criminalized for something that was outside of their control. Make sure you're always targeting it. In SLPs, make sure you're always